So let's go over the bones of the pelvis really quickly as a review, so you can start seeing where these muscles attach, their origins and insertion points. So remember, this is the pelvis. So this would be that I'm outlining is the sacrum and coccyx. You can't really see the coccyx down there behind the pubic symphysis. Oh, oops. This is the sacrum. This is the lower lumbar, the lowest lumbar vertebrae. This is the ilium. I always call them the big elephant ears. And they come around, and it comes around to about here. And it goes back posteriorly. The ischium is right after the ilium in the back here. And it goes down to about halfway down, then it comes up, it splits that acetabulum in the back, and it goes back there. So that would be the ischium. You can't see that much of it right now because that is your butt bone. That's the part that you sit on pretty much. And then of course we have the pubis that comes up front, comes around, takes up a third of that acetabulum, and comes around here. So that's the pubis, and that's the front. That's in the front. This is the ischium, and that's posteriorly. And then of course this is the ilium. Now let's go over some of these features. Let's start with the ilium up here. So up here, this entire top part of the big elephant ears is called the iliac crest. And it's this margin up here, and it goes around back somewhat, just a little tiny bit. And if you're holding the bone in your hand, you can see this kind of round. This is kind of rounds off like that, and it's a little rough and bumpy. Right here where it comes to a point, and I'll do it over here. See this little point that it juts out? And then there's another little point down here. So this is the anterior superior iliac spine, and so this would be the anterior inferior iliac spine. Now this place between this crevice between the sacrum and the ilium right here, it's the sacrum and ilium, so it's called the sacroiliac joint. See, sacrum and iliac, so sacroiliac joint. And inside of here, the back of the iliac is all rough and bumpy, and that's called the iliac tuberosity. And it's very rough back here, kind of in the sacroiliac joint and in the back posteriorly. Now this round place, that's for the ball and socket joint. You can see part of it because the pubis hangs over it, that lip hangs over it. So this whole ball and socket, that's where the femur head goes into. See, this is the femur. And this is called the acetabulum. And the acetabulum is split into 3 divisions, and it's all shared by all 3 bones: the iliac, or the ilium, the ischium, and the pubis. And you'll see on the next slide from the side view so you can see it better. This down here is the pubic symphysis. This is where the two pubis bones meet. So this is the anterior view, so this would be the left and this would be the right. This is a joint called the pubic symphysis, and it's SYMPHYSIS. Sim like symphony. Speaking of the pubis, this little lip that comes down and hangs over in the front, and it's really rough right here. You can see it really rough right here. These are called the pubic tubercles. Now, what is a tubercle? Anything with the word tuber in it, or also the word trochanter, pretty much all the T words that are a descriptor in these names here, that means a muscle attaches there. So there's going to be a muscle that attaches to the pubic tubercle. The holes in the pubis are called the obturator foramen. And remember, foramen is just a hole. After the iliac crest, I'll do it on this side. After the iliac crest, there's this depression in the anterior body of the ilium, and it kind of caves in a little bit. This is called the iliac fossa. And a fossa just means a depression in the bone. Now here's what I was talking about with the divisions. This is the lateral view. So here is the acetabulum right here. This big indention, and this is where the femur, the head of the femur goes into. It's a ball and socket joint. So, but do you see how these three are divided up? There's this red portion right there. This is the pubis. So this would be the front. And this is the ischium back here. So this would be the back. And then the whole thing is the ilium up here. Now you can see on here that there is also this bump back here, and this is called the ischial spine. Now that's different from what we looked at before when we were looking at the anterior view. This is the anterior superior iliac spine, iliac for ilium. So back here is the ischial spine. And it's not called the posterior or anything, it's just called the plain old ischial spine because there's only one. Now up here on the ilium is another section. You have a bump here, and you have the bump right here that turns into this notch. So this bump up here would be called, just like the anterior superior iliac spine, this would be the posterior superior iliac spine. And just like this one is the anterior inferior iliac spine, this is the posterior inferior iliac spine. And you know, the greater sciatic notch is the big notch between the ilium and the ischium. So you go down below the iliac spines and it makes this big notch, and then below that is the ischial spine because you're in the ischium now. The ischial tuberosity And remember what I just said, if it has the word tuber in it or anything like that, like tubercle, tuberosity, a muscle attaches there because it's a rough area. If you can see this rough area here. See how this is all rough and has bumps and everything in it? And this is also what you sit on. When you sit down, it sort of cradles your butt. So you're sitting here, this is your butt, and then your legs. So this is tuberosity, but muscles also attached there. Below the iliac crust, you can see how this dents in a little bit. This dent in here, that's the iliac fossa, which is a depression, sort of like just a slope down. It's like a little valley. And here, I'm going to say the iliac crust again, because this is really important because several muscles attach from the iliac crust at different points. So it's really important to keep in mind the iliac crust. Now here's another lateral view. This is facing the other way. So see, here's the pubic symphysis. Here's where the two pubis bones meet. So this would be the front. So this would be the back. And this is lateral, so this is the outside here, because you see the acetabulum? This is where the femur bone fits into. Now we're seeing the back side of the ilium. See, that we were seeing the other side in there. But now this is the posterior ilium. So this would be the back of the iliac crust. Do you see how rough it is? That's because a lot of the muscles attach there. And can you see these lines in the bone? These lines coming down? Those are gluteal lines. And I don't think you need to know the names of them, but I just wanted to point them out just so you saw them. Here's the greater sciatic notch. So this is posterior back here, right? So here is one bump, two bumps right above the greater iliac, or greater sciatic notch, excuse me, greater sciatic notch. So up above, right above the greater sciatic notch is one bump, two bumps. So that would be the posterior superior iliac spine and the posterior inferior iliac spine. And then right below the greater sciatic notch is this little nub sticking out right here. And this is the ischial spine. Because remember, the ischium starts right here and comes down and goes down to about there. And then the pubis is this whole thing. And then the rest is the iliac, or the ilium. Now over here in the front, here's one bump at the bottom of the iliac crust, and then there's a little tiny slope there, and then there's another bump. And so this would be the anterior superior iliac spine and the anterior inferior iliac spine. And here, back here in the ischium, you see this rough area? How it's got all of this? As I said before, this is what you sit on. This is what your butt sits on. And this is the ischial tuberosity. remember tuber, anything tuber is going to be rough and bumpy because a muscle is going to be attached to it. Now, as you can see, um, here is another picture of the hip bone. This is in 3D, so we can turn it around. Here's the back. Here's the side, the lateral view like we were looking at. And then here is the front. Oops. Here's the front. So this would be the pubis right here. This would be the ischium. This would be the acetabulum. This would be the ilium. And as you can see, we can show you the colors. This is the pubic crust, and this is the pubic tubercle. This would be where the pubic symphysis is. This is where it connects to the pubis, the other pubis. The body of the ischium right here. Here's the acetabulum. You don't need to know this. You don't really need to know this. Here is the anterior inferior iliac spine, and here's the anterior superior iliac spine. Here is the iliac crust that I was talking about, and notice there is let me see if I can get it, the inner lip of the iliac crust. Here is the iliac fossa, the big indention that I was talking about. And so here's the inner lip of the iliac crust right here. And if you turn this around to see the back of it, you can see the back of the iliac crust. And this would be the outer lip, this big little line right there. You can see this little line back here. This is the outer lip of the iliac crust. This is the posterior ilium. And here's the posterior gluteal line, the anterior gluteal line, the inferior gluteal line. Those were those lines that I outlined in the posterior bottom of the ilium, or back of the ilium. On the other side of here would be the iliac fossa. Do you see how this dents in around here? So the other side would be the depression, and so that would be the iliac fossa. But here, right here, this section right here that kind of blends into the outer lip of the iliac crust, and it's in the back of the iliac crust. This is called the tubercle of the iliac crust. And remember what we said, that if it starts with tuber, then it's probably going to be rough, and it's probably going to be an attachment to a muscle. This is the lateral view, just like we looked at the other picture. Here's the anterior superior iliac spine. Here's the anterior inferior. This is the body of the pubis. This is the pubic tubercle. This is the ischial tuberosity right here. And that's what you sit on. Body of the ischium. And here's the back of it, just totally the back of it. So this would be your right pelvic bone, because the femur would go right in here in the acetabulum. And so here's the greater sciatic notch. There we go, greater sciatic notch. And here's the ischial spine, body of the ischium. And here's the ischial tuberosity, this whole thing down here. So if you look at this just by itself, here was the ischial tuberosity, the ischial spine, the greater sciatic notch, the posterior inferior iliac spine, the posterior superior iliac spine. Here's the whole iliac crust in the back, the posterior section of the iliac crust. And we can turn this around. This is the lateral side. So back here is the posterior section of the iliac, of the ilium. Here's the part of the iliac crest that comes around like this. You see the pubis comes down here, and the pubic symphysis is up here in the front where it joins the other hip bone, your left hip bone. Here's where the femur goes in, the acetabulum. Here's the obturator foramen, the big hole. And this little lip that comes down, part of the pubis, there's the pubic tubercle right here. Here's the front. Again, here's part of the iliac crest, and you see it go back. See how this dents in? So that's the iliac fossa. You can see these bumps. That's the anterior, superior, and inferior iliac spine. And here's the pubis right here, pubic tubercle. And here's the acetabulum where the femur fits in. And the ischium is back here. And this is what you sit on. So it's rough behind here posteriorly.